Hey, Bo, can you hear me?
I can.
Okay, great. Hey, you and I were having a conversation masked in my office last week about the number of calls we've been getting from folks who feel as if their medical providers were not fully communicating to them what their diagnosis was or their treatment plans, and just really concerned about people leaving a doctor's office, a hospital, or a nursing home knowing very little about their condition because of lack of communication. Have you been seeing that a lot when it comes to calls that you're taking?
I have. And unfortunately, that's something we see with some frequency. It's not uncommon for that to be an issue for patients with their medical provider.
Right. And sometimes we actually see it between providers as well.
Correct. And when you have so many different healthcare providers for an individual patient, it's not uncommon for there to be a lack of communication between the physicians.
Now, Bo, how do you, when a cold caller contacts you, differentiate between just bad communication and then a violation of the standard of care as far as communication goes?
That's right. I mean, a lack of communication, if it's egregious and leads to serious harm for the patient, that would be an instance where there might merit legal action. But if it's something minor and that there isn't significant harm to the patient, then it's likely not something where we would get involved.
Right. Now, in the 15 years I've been doing this, I can think of some cases where lack of communication has truly changed someone's life outcome. We've had cases where people have had CTs never looked at and cancer was allowed to grow, pap smear tests never looked at and cancer was allowed to grow. We've seen radiologists not communicate directly with doctors and then something would go untreated. So sometimes you really do see lack of communication as being the negligence that unfortunately changes someone's life forever.
Absolutely.
Yeah. Now, real quick before we go, what are you advising patients during COVID when they don't have a lot of communication at all about their loved one's health? How are you advising people to do their best to bridge the communication gap?
A lot of providers, particularly at bigger health institutions, have online messaging like MyChart, or you can call the office and leave a message. There are a variety of different ways you can do it and avoid in-person, face-to-face interactions.
That's really smart. And I think you and I both know if it happened in writing, it happened. If it didn't happen in writing, it often didn't happen.
Absolutely.
That's right. Well, Bo, thanks for your time today. I can't wait till hopefully everybody's vaccinated and we can have this conversation in person sometime soon.
Thanks, Lauren.
All right, bye.